My name's Jennifer Graves. Today we're here at one of our 2 tents built on a soccer field at our COVID-19 Assessment Center and Recovery Center.
I've been a nurse for more than 30 years, and this has been a true labor of love project. In our state, in Washington, we're one of the lowest hospital beds per capita in the country. As the pandemic unfolded, there was great worry as we were learning more about the disease spread, trying to figure out how do we make sure that people had care in the community and to preserve our hospital beds for those who most need it. And so our president at Kaiser Permanente met with the leadership of public health and said, what needs do you have? And Patty Hayes, who's the director of public health, Seattle-King County, and she said, what if we partnered to staff this big structure that we're building? The homeless population is getting COVID a little bit later than some of the other populations in Washington. The people that we're serving here are people who would not otherwise be getting care anyplace else. There's no discussion when people are coming about insurance coverage or lack of insurance coverage or people's ability to pay, and this is all free. For assessment, we can bring in people from homeless shelters, people who are living in tents, and people who don't have other resources to do the COVID-19 testing. The recovery piece is for people who are known COVID positive. They need a safe place to go to be isolated. They can still take care of their medical needs. So this is a little bit lower level of care than a hospital, but it's still staffed by clinical staff 24 hours a day.
Good morning. The first thing I need to do is get your temperature, and then we're going to do a symptom check before we get you your scrubs today. Okay, here you go. Thank you.
The question often will come up about personal protective equipment and testing supplies. We know different places across the country are in different situations. In Washington State, there's been a lot of working together to make sure that everybody has resources. It doesn't mean we aren't looking at our supply chain every single day, because we are. So everybody that goes into the tent to care for people is in full PPE. Two sets of gloves, because we treat one pair of gloves on the lower half like it's your skin. A full gown, a mask, and then we also provide a full head or face shield so that all of the mucous membranes in the face, so eyes, nose, mouth, are completely covered. We check each other off on a buddy system on our PPE as we're going in and as we're going out.
So, as a buddy, she'd come to me and she'd show me. I'm looking to make sure that the arm cuffs of her gloves are coming and the sleeves are completely covered. The sleeve, there's no gap or skin visible, and shield's intact. Mask, I'm verifying the fit and just making sure she's looking covered. Turn around for me.
We're really careful to have each other's backs, literally and figuratively. The staff who are here volunteer completely willingly to come. Everyone is positive and working together and knows that what they're doing is really meaningful. I've been here pretty much 7 days a week. I don't think we should turn away from people who are most in need of our care. I became a nurse because it's my calling. I'm a cancer survivor. I go in just like everybody else. This feels right. We had a staff member on Sunday that chose to come and work 12 hours on her birthday because this is where she wanted to celebrate. Sorry. So lots of stories like that. There's 2 tents. Tent 1 is where we have all of our patients cohorted right now. They each hold up to 70 patients with individual rooms, if you will, with a cot and a foot locker for belongings.
We've installed at every bedside a light switch that will flick on a red light that we'll be able to notice from anywhere in the tent when patients need to call for help.
Outside of the tent, they can grab hot showers whenever they would like. We can take patients out for small supervised walks. We realize exercise and fresh air is really, really important. There are community members who are leaving little rocks and little crosses with messages all over the property for us. There was a little painted rock yesterday that said, "We got this." I made the right career choice in becoming a nurse. I have hope for our healthcare system, and when we get focused on doing the right things for our communities, we can do things quickly and we can do things in partnership with others, and we can make a better healthcare system for the future. And I'm hoping we take those lessons away after this pandemic leaves our midst.